What is chronic pain? Chronic pain is often defined as any pain lasting longer than 12 weeks, whereas acute pain is a normal sensation that alerts us to possible injury. Chronic pain is very different. Chronic pain persists, often for months or even longer. It can be mild, excruciating, episodic, or continuous. Sound familiar? We are sure that either you or someone you know is suffering or has suffered from chronic pain and has taken prescribed or over-the-counter painkillers over an extended period of time. What is the cause of chronic pain? Most chronic pain is caused by musculoskeletal disorders. Musculoskeletal disorders are among the most prevalent long-term illnesses, and they account for more pain and sickness absence from work than any other medical condition. The most common condition of musculoskeletal complaints is lower back pain, followed by pain in the neck and shoulder area. What are the symptoms? Pain, usually chronic, restriction of movement, degeneration of tissue structures, inflammation. The constant pain causes depression, loss of working days, excessive diagnostic testing, and treatment costs, including surgical, and often early retirement. Bonitas Medical Fund, Bonitas, and Document-Based Care, DBC, are working together because we know that chronic pain destroys the quality of life for so many. The world-renowned DBC program incorporates evidence-based protocols to improve functional ability and work capability, successfully and effectively with the minimum amount of pain. Most chronic pain is back and neck related. People who recover the fastest and cope the best are those who stay active. If the pain is prolonged or recurs often, exercise is highly recommended for pain relief, which is why functional treatment has been devised to treat chronic conditions of the back and neck. The last thing most of us want to do when we're in pain is to exercise, but we need to. And functional treatment is different in that you are doing the movement according to your level of tolerance of pain. What is DBC? The program is pivotal around movement and recovery. Called functional rehabilitation, it is a combination of physiotherapy and musculoskeletal rehabilitation. Same old, same old. Not at all. DBC is interdisciplinary functional rehabilitation, including treatment from doctors, physiotherapists and biokineticists to treat severe neck and back pain. After an initial assessment, beneficiaries receive treatment twice a week for 3 to 6 weeks. Bonitas covers the full cost of the program, except on bond cap. How did DBC start? In 1993, a group of Finnish experts set out to develop new, more effective methods of physiotherapy and rehabilitation for back and neck pain. The result was DBC, the global leader in functional rehabilitation for chronic back and neck pain. Today, DBC is an international success story in 22 countries.
So what does the DBC do for your neck and back? Restores ranges of motion, restores muscle coordination, movement control, improves muscle endurance and strength. It improves general condition, re-education between normal loading and pain, reducing fear avoidance behavior, and tackling psychosocial obstacles.
My name is Theo. Actually Theophilus, but everybody calls me Theo. I am with Bonitas for the past 11 years, and I had 2 back operations 3 years ago. I hurt my back again. I took painkillers 3 times a day for almost 14 months. So then Bonitas contacted me and they told me about this program. Never felt sorry that I started with this program and I saw it through for the 6 weeks. It was like within that 6 weeks of therapy, I went almost down to only once a day that I at times needed to take painkillers. And for the crutches, I still don't use them anymore. If anybody needs this program, then I will recommend it.
Document-based care, or DBC, is an active back and neck rehabilitation program that uses exercises, motion and weights to restore function and improve your quality of life. All Bonitas members can have access to DBC if they qualify, except for members on bond cap. You can be referred by your GP, by the Beneficiary Risk Management Program, or you can self-refer. What does it consist of?
Step 1.
Before the clinical assessment is done, you need to complete an online assessment form. You will then be assessed by your doctor and your biokineticist. It will include a physical examination to test your range of movements, your nerves, and much more.
Step 2.
The doctor will take your medical history and explain the DBC protocol to you.
Step 3.
A treatment program will then be put together for you, and you'll need to sign a contract that commits you to the 6 weeks of treatment 2 times a week. The treatment is an hour long, 30 minutes with a biokineticist and 30 minutes with a physiotherapist.
Step 4.
After the initial 6 sessions, your doctor will re-examine you to determine your progress. The protocol is then repeated, 6 sessions over 3 weeks. If all is well, you are then discharged with a home exercise program. You will also be able to attend regular maintenance sessions with your biokineticist to support you on your road to recovery.
My name is Tertia. I was advised I had slip disc. It was a bulge in the spine. I had an X-ray done first, and then of course the MRI scan was done. And doctor showed exactly what was wrong with my back. I had continuous pins and needles running down the outer thigh into the inner soles of my feet. Constant pain, sleepless nights, and pain wasn't going away. I was referred to come on the program by Bonitas. Positive experience of what I've had. I'm pain-free at the moment. I don't require any pain medication. I enjoy my exercises. I do it constantly at home. I do have a lot of fun with Johan and with Luke, which is of course my physio and my biokinetic. So yes, even with doctor, she's explained to me what was required of me, and yes, I've put my all in, and I can only advise others that it's well worth coming on the DBC clinic program for their backs or their neck injuries for that matter.
Many people do not exercise or get active when they are suffering from chronic pain, so we are really careful to distinguish between good and bad pain. We have so often witnessed fear avoidance when a patient is too scared to move in case of causing pain. We assist you in determining your limitations and expectations and help you recover at your pace, ensuring that you are comfortable.
Where are DBC centers located? There are currently 13 centers located across South Africa. In Cape Town, Bellville, Durban, Pietermaritzburg, Cecilburg, Secunda, Emalahleni, Rosebank, Roodepoort, Kempton Park, Centurion, Pretoria East and Pretoria North. Plans are in place to expand the network.